We are continuing to track Kentucky's ongoing fight against COVID-19. Many are hoping that the vaccine will mark the beginning of the end of the pandemic.
But it's not over yet. Joining us now is Kevin Hall from the Lexington-Fayette County Health Department. Kevin, we know you're busy right now, to say the least, so we certainly appreciate you taking the time. We know 2020 has been a wild ride so far. How are you feeling about where we stand right now in terms of the pandemic here in Lexington?
Well, there's definitely hope because the vaccine, as Dr. Stack and the governor have said, there's light at the end of the tunnel. But for most people, that tunnel is still a very long distance. The wide availability to everyone, we're looking months away, probably the spring, before the average person is going to be able to get that vaccine. That said, there's still hope.
So we're watching these numbers very closely, Kevin, and Lexington's recent cases seem to be lower than what they have been. Can you put that into some perspective for us? I mean, is it any time to relax at all?
Absolutely not time to relax. Now, while we are happy that the numbers have been lower, that's a relative term. If you look at the cases, we had about 150 today. That's still twice what we were seeing as recently as October. And unfortunately, the number of hospitalizations continues to grow.
So we can't get complacent.
Yeah, we cannot get complacent. We need to follow the guidelines and keep people as healthy as possible until that vaccine is here for everyone.
And speaking of that vaccine, I think one question a lot of people have right now is when they are available to the public. We want a timeline for that, obviously, but also, are we going to have like a choice whether you want maybe the Pfizer vaccine, Moderna, maybe one from Johnson & Johnson? Is that something you think people will be able to decide for themselves?
It's a great question, and it's something I really don't know the answer to right now because we're still getting information about those doses from the different companies coming in. And
then what do you think the timeline's going to be?
In terms of the arrival, we're hoping that as soon as the Moderna vaccine gets approval, that it operates as quickly as the Pfizer vaccine and gets into Kentucky a day or two after it's available and shipped out. In terms of of it being available to everyone, we're thinking spring, March or April, but all of that could change like we've seen with COVID-19. There's new information daily.
And we've talked about how we can't get complacent, and even once the vaccine is out and available to people, we're still going to need to be wearing masks and social distancing even after that happens. So how long do you think that's going to stick around?
Well, if you listen to Dr. Fauci, he has said probably through the end of 2021, maybe even into the year after that. What we do know, though, is exactly what you said. We aren't going to get the vaccine and suddenly go back to pre-COVID-19 life. There will be adjustments. The vaccine is just a piece and one tool of that recovery.
Okay, as we await the Moderna vaccine, which we believe could be approved as early as today, do you anticipate those will be shipped in as quickly as Pfizer was, say, by early next week?
Our anticipation is to be ready as early as next week, as you said. We don't know for certain when it will arrive. A lot of that depends on the approval process, but our expectation is it will be as quickly into Lexington or quickly into Kentucky as we saw with the Pfizer vaccine.
All right, Kevin Hall joining us from the Lexington-Fayette County Health Department. Thank you so much. We appreciate it.